is Dee, and I'm going to be just taking a look at some of your oral features, okay? So if you could just open your mouth real wide for me. Moisture looks good, dental care is good, clean, no missing teeth on top, and she has no missing teeth on bottom. So, okay, thank you very much. Okay, so now I'm going to be just checking to see how your nerves are, and I'm going to be using this swab. It's got what we call a sharp side and a dull side, and what I'm going to ask you to do is just close your eyes, and I'm going to touch you in some different places on your face, and you tell me if you feel the sharp side or the dull side, okay?
Sharp. Sharp. Dull.
Okay.
Sharp. Dull. Dull. Sharp. 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 Dull. Dull.
Okay. And now I'm going to do the same thing, but I'm going to do it inside your mouth, okay?
Okay.
So all I want you to do is just raise your hand anytime you feel that I'm touching you, okay? And so I'm going to ask you to open your mouth and stick out your tongue, and remember you're going to raise your hand when you feel me touching. Okay. Very good. That's all I have for you.
Okay, the first thing I'm going to do is look at some of your reflexes. Okay, there's no jaw jerk reflex. There is no sucking reflex, and the next thing I'm going to do is look and see if you have a gag reflex. So what I need you to do is open your mouth as wide as you can. Okay, there is a gag reflex on the left. Okay, there's a gag reflex on the right. Now I'm going to look at her jaw muscles. So at rest we see that they are symmetrical. Please open your mouth as wide as you can. And it seems that the jaw is deviating to the right. Now looking at range of motion, please open your mouth as wide as you can again. And the rangelets within normal limits. Can you move your jaw from side to side for me? And that rangelet's at like normal limits as well. Now I just want to feel, and as I'm feeling I hear a popping, I feel a popping sound which may be evidence of TMJ. Now looking at the string, please bite your teeth together. Okay. I can feel the masseter and I can feel the temporalis. Those are easily palpable. Bite your teeth together and don't let me close them. Don't let me open your mouth. Okay, I'm not able to open her mouth. Open your mouth as wide as you can and don't let me close it. I'm not able to close it. And I'm going to push on the side of your jaw, but don't let me move it. Okay, I'm not able to move her jaw. Now looking at the speed, please open and close your mouth as fast as you can. Okay, that was within normal limits. Move your jaw from side to side as fast as you can. Okay, that looks like normal limits. There was maybe a little bit of groping. I saw some flinching with that. That may have to do with the popping. And it looked as if the range of motion did not diminish. Looking at the steadiness right now, it looks normal. We see no fasciculations, tremors, or chorea. because the jaw was functioning more within normal limits, I didn't need to give her any cues, and there was no evidence of jaw fatigue.
Okay, so the first thing I'm going to do is look at your facial expression muscles, and at rest right now I see good symmetry on both sides. Now I'm going to look at your range of motion. So first, show me your teeth like this. Okay, very symmetrical. Is that how you typically smile? Oh, good, spontaneous symmetry. So pucker your lips like this, like you're gonna kiss. Okay. Puff out your cheeks. All right, good symmetry bilaterally. Raise your eyebrows for me. Nice. Close your eyes as tight as you can. Okay, fully close both eyes, wrinkling around both eyes. Look up at the ceiling without moving your head up. Very nice. Symmetric, wide eye opening bilaterally. Now I'm going to test your strength a little. So hold this tongue depressor between your lips and don't let me pull it out. Okay. Tight lip seal was maintained. Pucker your lips like a kiss, but don't let me spread them into a smile. Okay. Tight pucker bilaterally. Smile and show me your teeth, but don't let me push your lips into a pucker. Okay. Puff out your cheeks, and I'm going to push on your cheeks, but don't let the air out. Good. Tight seal is maintained bilaterally. Okay, I'm going to look at some speed. So I want you to smile and then pucker as fast as you can, several times. Okay. Within normal limits. Move a ball of air from one cheek to the other. All right. So with that, I didn't see any diminished range of motion or groping voluntary jaw movements, and I didn't see any involuntary muscle movements like fasciculations or tics, and she can inhibit facial movements on request. So I didn't need to provide her with any cues, and I didn't notice any fatigue. So now I'm going to look at your velum and look at the symmetry at rest. So could you open your mouth wide for me? Okay, good. Midline velum, and open your mouth wide and say ah. All right, symmetric bilaterally. That's all I have to do.
All right, say ah as long as you can. All right, thanks. All right, I didn't see any clouding on the mirror, so there was no nasal emission there. I'm gonna check for the same thing here. I want you to blow this tissue with your mouth, not with your nose. Again, she was able to move the tissue and she had no fogging or cloudiness on the mirror. No groping oral movements or fasciculations. Okay, cough hard like you're choking. Very good. All right, say this after me. Up, up, up.
Up, up, up.
All right, good job. She demonstrated a hard glottal attack. It was dry and wet, strong and dry sounding. Take a deep breath and hold it tight. So my stethoscope. All right, perfect. I was listening for audible air leakage and I didn't hear any. I want you to say ah as long and as steady as you can. Okay, perfect. So I recorded the duration in seconds. I noticed that it was a stable pitch and adequate loudness. Pitch seemed normal and so did loudness control. No cues were necessary. So now I'm looking for symmetry. Open your mouth wide. Okay, she looks symmetrical at rest. These are for range of motion. Stick out your tongue straight and as far as you can. Good. Wiggle your tongue back and forth to the corners of your mouth. Good. Use your tongue tip to look all the way around your lips like this. Good. Range of motion is looking appropriate. Use your tongue to clean all the way around your cheeks. Good. Same there. Scrape your tongue along the roof of your mouth. Start at your teeth and scrape as far back as possible like this. Good. Open your mouth wide and touch your tongue tip to your upper front teeth and your lower. Good. These are for strength. I want you to push your tongue as hard as you can against this tongue depressor. Good, now you're gonna go to the side. Sorry. Good, and this side? Awesome. Okay, now I want you to push out your cheeks with your tongue and push against my fingers. Perfect. This side? Awesome. Strength is looking within normal limits. Click the tongue on the roof of your mouth like this. Perfect. Thank you.
Okay, now we're gonna look at tongue speed. So I need you to wiggle the tongue to the corners of your mouth as fast as you can. Good. Okay, now wiggle your tongue inside your mouth from cheek to cheek as fast as you can. Okay, good. Now click the tongue to the roof of your mouth as fast as you can. Good, okay. So everything seems to be accurate, steady, and no cues were necessary, no evidence of tongue fatigue. Okay, now I'm looking at your overall posture. Everything seems to be at midline within normal limits. Okay, raise your shoulders for me. Good, okay, you can relax now. Look over your left shoulder, then look over your right. Good, okay. Now tilt your head to your right shoulder, then to your left. Okay. Point your chin up to the ceiling, then down to the floor. Good, okay, so everything seems to be within normal limits. Okay, so now raise your shoulders and don't let me push them down. All right, nice resistance there. Okay, so now tilt your head towards my hand. Okay, good resistance there. Same thing here. Trying to rotate your head. All right, now same thing. Lean your head, don't let me move your head. Lean it against my hand. Okay, I'm trying to move it down toward the shoulders. Okay, good resistance there. No cues were needed, no evidence of neck or trunk fatigue. Okay, so for the next 15 seconds, I am going to watch just how you breathe, okay? I'll tell you when I'm going to start. Okay, now. Okay, thank you. We are all done.